How well do you know Lyme disease? I'm Dr. Daniel Cameron. I'm beginning a series of questions. Let's see how many you get right. I'm beginning with question 1 to 10, and thank you for joining me. So let's begin. Question 1. Which cranial nerve is responsible for Bell's palsy seen in Lyme disease patients? That would be C, the seventh nerve. Question 2. Which tick-borne condition is most commonly associated with nighttime sweating? Babesia is a condition, a parasitic condition that can lead to dysautonomia. Sweats are one of the earliest manifestations, along with all kinds of other manifestations. Any of them can cause sweats. Question 3. Which tick-borne condition is treated with medications most commonly used to treat malaria? That would be A. Babesia is a parasite. It resembles in some ways malaria. The treatment that one might use for malaria is helpful for babesia. It's marketed as atovaquone as the primary treatment along with azithromycin. I use the oral version of Malarone more often than the oral version of Mepron. In which condition might you see parasites in the red cells early in the infection? That would be D, babesia. Babesia was first identified as a parasite in the red blood cells in patients who were acutely ill, who have been in the hospital, and it can lead to hemolysis. Later, the parasite clears the red cells, and patients can be quite sick. Some patients aren't even that sick. They might only find out they have babesia because they donate blood to the blood bank, and the recipient gets babesia. And question 5, in which condition might you see fatigue, exercise intolerance, and gastrointestinal distress? All of these are manifestations of Lyme disease, but this particular answer would be best served as A, POTS, postural orthostatic tachycardic syndrome, because this is characterized by dysautonomia. That is, there's something wrong with the autonomic nervous system, so automatic things like movement, the stomach, and sensory system is off, and that's why you see gastrointestinal distress. Are you still with me? Good, because the trickiest questions are coming up next. In which of the following age groups is POTS most common in Lyme disease? I've found it most common in children and adolescents and young adults. Now, lightheadedness from movement, tachycardic from movement can occur in all ages, just more dramatic in A. In which of the following age groups is tics, Tourette's syndrome, and OCD most problematic in Lyme disease? Again, that would be children and adolescents. I see multiple issues in all ages involving psych issues, OCD issues, not so much tics or Tourette's. I've seen atypical seizures, but the best answer for this would be A. Which, what does heart block refer to in Lyme disease? That would be A, conduction problems. Heart block is an early manifestation of Lyme. It doesn't happen that often. Usually within a week or two of onset, it clears out. Patients can sometimes have palpitations, tachycardia. They're often seen by cardiologists, but that finding of conduction problems is usually the first week or two. What is the most common finding in Lyme arthritis? That would be B, synovitis. They first discovered Lyme in the 70s. It was thought to be juvenile rheumatoid arthritis. The synovitis was a sac in the knee. It could extend into the back of the knee, called a Baker's cyst. Now there's other soft tissue that's in the hip called bursitis, the low back called sacroiliitis. It can also be in the hands and other parts of the body, the shoulders. It's mostly a soft tissue. In which of the following conditions can be prevented with a single dose of doxycycline after tick bite? They were able to show that you could prevent erythema migraine rashes with those two 100 milligram tablets of doxycycline, But the study did not go on to show if it would prevent other very important manifestations of Lyme disease, like Lyme arthritis, Lyme carditis, and POTS. That's the quiz. How did you score? 1 to 3, you're on your way. 4 to 6, solid effort. 7 plus, you nailed it. So share your score in the comments, tag a friend to challenge them, and thank you for joining me.